name is Dr. Jones. Nice to meet you. Please take a seat. So how can I help you today? You have problems with your hearing, is that correct? Okay, yeah. Okay, I'll just take some notes, if you don't mind, whilst you explain your symptoms to me. Yeah. Okay. So, I'll ask you a few questions now, if I may. Are you experiencing periods of vertigo or dizziness at all? Okay. Are you noticing that you're able to hear better out of one ear or the other? Okay. Okay. And just to clarify, you've never had a hearing aid, have you? No? Okay, that's good. Is there a history of hearing problems in your family? And also, is there a history of blood pressure related problems? Okay. Okay, that's good to note. So, are there particular situations that you're struggling to hear in, perhaps when someone is whispering to you? And what about identifying one sound amongst a crowd? So say we were having a conversation and there were also a large crowd of people around us also talking to themselves. Would you struggle to hear what I'm saying, do you think? Okay. Okay. And final question, has anyone mentioned to you that you speak very loudly when talking to someone one-on-one? Okay, I only ask these questions because they could potentially be signs of a problem with your hearing, but obviously we'll examine your ears today, get to the bottom of the problem. So I'm going to use an otoscope now to look into your ear canals. I'll just pop on some latex gloves first, if that's okay. So I'll be 2 seconds. Just pop a fresh part on the otoscope for you, nice and clean, nice and sanitary, of course. Double check that. Yeah, that seems to be working. Okay, I'm going to take a look in this ear first, if I may. You shouldn't feel any discomfort. This will be going in your ear canal, but nothing too deep. Obviously, please let me know though if you do feel any discomfort, and I'll be more gentle, stop at once, whatever needs to be done, okay? Okay, let's take a peek in this ear, see what we see. Okay. So I can see a heavy build-up of wax actually, and also there is a lot of redness in the ear, probably caused by the excessive build-up of wax. I'm just going to move on and check this ear as well, see if it's a problem in both ears or just the one. Okay. So there is also a big build-up of earwax in this ear as well. Looking about the same issue in both ears. So what I think we should do first of all is to clean both of the ears out. I'll perform that for you now, of course, no problem. do first of all is I'm just going to use this solution. I'm going to pour it into both of your ears, just a few drops in each ear, don't worry. And this is just going to soften up the earwax and allow me to clean out each ear a lot better and a lot more thoroughly than if I didn't use it. So if you could tilt your head to the side for me, please. Let's pour a few drops in there. Absolutely fantastic. And if you could tilt your head to the other side for me, please. Tip a few drops in there. Excellent, thank you. Don't worry about them spilling out. It's more of like a gel substance, so it's got a sort of thicker consistency. So I'm going to start work on this ear now. Just going to be using cotton buds and a simple scraping tool. It shouldn't be discomfort or pain again, but obviously let me know if you do experience anything bad like that. Okay. Okay, here we go. Just going to make a start on this ear now. How is that feeling so far? That's good, thank you. So I'm just going to start using the cotton bud now. Again, that's not too rough for you, is it? That's good. So I'm going to have to be very careful here, and it will sound a lot louder to you, obviously, because I'm closer to the eardrum, and it might feel a little bit more intense, but it shouldn't be painful again. So do let me know if it's too much for you. How is that feeling so far? Yeah, okay. Excellent. This ear is done. I'm going to move on to the other ear now. Here we go. How does your other ear feel? The one I've just cleaned. Can you notice any difference? Feels a lot different. Okay. outer edges of the ear, so shouldn't feel too bad this part. Okay. Yeah. Okay, and now is the point where I'm going a little bit deeper into the ear canal, so again might feel a bit more intense, so to speak, than the previous parts. And I'm going to have to concentrate just to make sure that I'm careful. You feeling okay with this, yeah? Okay, I think we've finished with both now. Okay, so the next thing I'd like to do is a hearing test, and for this I'm going to be using a pair of headphones here. Just adjusting them a little bit to make sure they're nice and comfortable for you. Basically, I'm going to be making sounds through a microphone, and these sounds will then play through these headphones. It's going to be at controlled volumes, decibels, and frequencies. And basically, if you perform well during this section, then it means your hearing is very good. And from that, we'll obviously take away that the ear cleaning I just performed on you was successful. So I'll just pop these headphones on you now, if that's okay. And how does that feel? Nice and comfortable? Okay, cool. Okay, so now I'm going to be using this microphone. Is that okay? Can you hear me okay? You can hear me in both ears, okay? Excellent. The first test is very simple. I would like you to repeat back a word that I'm about to say to you, okay? So, first word. Oranges. Very good. Banana. Very good. Snail. Very good. Tiger. Very good. Balloon. Very good. Licorice. Very good. There we go. Excellent performance. You could hear all of those fine. So, as I move from side to side of the microphone, you should notice the sounds playing in one ear or the other, depending on what side of the microphone I'm on. Have you noticed one ear is able to hear sounds more clearly than the other? Now, about the same. Okay, that's excellent. That's exactly what we're hoping for. Okay, so now same test, except I'm going to be using numbers. Okay, so if you could repeat back the numbers to me, please. 72. Very good. 63. Very good. 712. Very good. 809. Very good. 1632. Very good. 7671. Very good. All numbers repeated back correctly. Looking good so far. Now what I want to do is mark the edges of your hearing, so to speak. So in order to do this, I'm going to be producing a sound just like this, and I'm going to be moving it further and further away from the microphone. And if you could tell me please when you can no longer hear the sound I'm producing. Okay, so here we go. Very good. We'll try with the same with the other ear. Excellent. I'm going to do them both at the same time. Very good. And how did that sound, the both at the same time? Did you notice it disappeared in one ear before the other, perhaps? No, about the same. Very good. I just want to clarify it one more time, so I'm going to repeat the same thing. Very good. Same for this side. Very good. And again, both of them. There we go. That's excellent. Looks like the range was about the same for both ears and about the same on both repeats. So this is a very good sign. I'll take the headphones off you now, Darren. There we go. Thank you. And we'll pop this microphone away now. Okay, there we go. I'm actually very satisfied with your level of hearing now. You passed the tests perfectly well. How do you feel personally about your hearing now? Do you think your problems have improved from when you came in here? Yeah, very good. That sounds excellent. That sounds very promising. Okay, so obviously I'm going to take these notes and type them up, and we'll keep you on record. What I recommend is just going about your day-to-day business, and if you notice any of your problems either returning or if they haven't disappeared, then definitely phone us, book another appointment, and we'll take a deeper look at the issue. Perhaps there is something else that we can do to help you out. Okay, so I think we've finished then. Yeah, anything else I can do for you before you leave today? No? Excellent then. Thank you very much. Thank you for coming today. Take care. Have a good one.